Skin cancer is quite prevalent. Probably about 1 in 5 Americans will have skin cancer before the age of 70. It ranges from basal cell cancer, which is quite indolent in its behavior in people with normal immunity, all the way to melanoma, which is aggressive and usually requires more involved treatment. I've seen a lot of farmers develop various kinds of skin cancers because these are individuals who spend a lot of time outdoors and doing a lot of hard, necessary work. And sometimes, applying sun protection is not always at the top of their mind, right? So it's cumulative. So your risk increases as you get older because, whatever sun exposure you've had when you were 20, you've had more when you're 50. And certainly that's why we talk about, the chances of getting skin cancer as you approach 70 and say that about 1 in 5 people have skin cancer before the age of 70. Because the DNA damage and the kind of risks that you're exposed to is a cumulative effect. So there's a cumulative damage to your skin. A lot of times we'll see neglected skin cancers because patients will say, well, I've had that mole forever. But even skin lesions that you have had so-called forever, you need to pay attention to. Some of the warning signs, for example, includes growth, anything that's growing. Well, I do remember that this is not as large, this is a lot larger than it used to be. That's a troubling sign. The shape, and if it starts changing orientation, becoming more irregular, if it starts becoming discolored, you used to have this mole that was a particular color, and all of a sudden you start seeing transition in terms of, so it's now different shades and different colors. That's also concerning. And of course, anything that becomes ulcerated and bleeds, those things suggests a problem, and certainly something that should be evaluated by your primary care doctor or by your dermatologist. If you're going to spend a lot of time in the sun, wear sunscreen, and most organizations recommend SPF factor of 30 and greater. Applying sunscreen, and not just applying sunscreen, but reapplying sunscreen. You have people that maybe they're going to spend an entire day in the sun, and they'll apply sunscreen diligently before they go outside, and then you don't reapply. That's a problem. And then protective clothing. If you're a golfer, wear a hat. Long sleeves, depending on your risk factor. I'm not aware of anything positive that comes out of indoor tanning. I think that indoor, there are more indoor tanning solutions in the United States than there are McDonald's. So it's a very, very popular business, and I would, my criticism of it is probably that it's a very poorly regulated industry. And individuals are tanning at frequencies that go well beyond any kind of recommendations for that kind of exposure. So that kind of intense UV exposure is problematic. So I would definitely recommend against indoor tanning. Smoking is a high-risk behavior, not just for skin cancer, but for a lot of other kinds of cancer, almost every other kind of cancer. Smoking increases the risk. So I would say those kind of behavioral things, those kind of things that you could definitely mitigate. Don't smoke and don't do indoor tanning. Those are definitely behavioral changes that will have a significant impact on the possibility of getting skin cancer.